Find us here. YouTube. At Zimmers 5 Minutes 857 Twitter. At ZM Health Science TikTok. Zimmers 5 Minutes WeChat. G May 5 Fen Zhang. An aging society refers to a population where the proportion of older adults, typically defined as those aged 65 and above, is increasing relative to other age groups. United Nations, 2019. This demographic shift is a global phenomenon, driven by a combination of factors such as declining fertility rates, longer life expectancy, and improvements in healthcare and public health. Aging population. The World Health Organization, WHO, defines the older or aging population as those individuals aged 60 years or older, WHO, 2015. However, this definition may vary across different regions of the world and may be influenced by factors such as life expectancy, socioeconomic conditions, and cultural norms. WHO emphasizes that aging is a lifelong process that begins at birth and requires holistic care and support. Global trend. By the end of 2021, people aged 60 and above accounted for about 19% of China's total population, with the demographic estimated to grow to over 30% around 2035, Tone, 2022. The 65 and older age group's share of the total population in the United States will rise from 16% to 23% by 2022, U.S. Census Bureau, 2022. In 2022, more than one-fifth, 21.1%, of the EU population was aged 65 and over, Eurostat, 2020. Japan is aging rapidly, with those over 65 already constituting 27.7% of the total population in 2017, the highest in the world, and projected to grow continuously up to 31.6% in 2030, Nakatani, 2019. The entities listed below are some of the largest economies in the world, with significant impact on global trade and finance. These countries are United States, European Union, China, Japan, Germany, United Kingdom, India, France, Italy, Brazil. These entities are often measured by gross domestic product, GDP, which is the total value of goods and services produced within a country's borders. Aging population percentage in these countries by 2021 are age dependency ratio, old, percent of working age population, data, N.D. 1 United States 16.6%, 2 European Union 20.7%, 3 China 13.5%, 4 Japan 28.4%, 5 Germany 22.3%, 6 United Kingdom 19.0%, 7 India 8.6%, 8 France 20.6%, 9 Italy 23.1%, 10 Brazil 9.8%. These numbers indicate the percentage of the population aged 65 and older in each country. As you can see, many of these countries have a significant aging population, which can have important implications for healthcare, social services, and economic policies. Social and health problem caused by aging society. Major social and health problems caused by social aging include social isolation, economic insecurity, ageism, and an increased risk of chronic diseases, such as cardiovascular disease, dementia, and cancer. Social isolation, in particular, is a significant issue for older adults, as it can lead to loneliness, depression, and cognitive decline. Hockley and Cachopo, 2010. Economic insecurity is another problem, with many older adults living in poverty or facing financial strain due to inadequate retirement savings and rising healthcare costs. United Nations, 2019. Nurses' role in aging society. To address the social and health problems associated with aging, nurses play a critical role in providing direct patient care, advocating for their patients and families, and educating patients and their families on disease prevention and management. Nurses are also uniquely positioned to address social issues by identifying patients who may be at risk for social isolation, advocating for social support services, and collaborating with community organizations to address economic insecurity and ageism. Wagner and Hassanein, 2021. Nursing education programs must provide specialized training in gerontological nursing to effectively address social aging and promote healthy aging through disease prevention and management, medication management, and health education. Nursing scientists can play an essential role in solving problems in aging societies. Here are some ways nursing scientists can contribute. Research. Nursing scientists can conduct research to identify the health and social problems faced by older adults in aging societies. They can investigate the impact of social isolation, economic insecurity, and ageism on the health and well-being of older adults, and identify effective interventions to address these problems. Advocacy. nursing scientists can advocate for policies and programs that support the health and social needs of older adults. They can work with policymakers and community leaders to develop and implement policies that address issues such as access to health care, affordable housing, and social support services. Education. Nursing scientists can educate healthcare providers, policymakers, and the public on the needs of older adults in aging societies. They can provide education and training to healthcare providers on gerontological nursing, and advocate for the inclusion of gerontological nursing in nursing education programs. Collaboration. Nursing scientists can collaborate with other healthcare providers, community organizations, and policymakers to develop innovative solutions to the health and social problems faced by older adults in aging societies. They can work with social workers, psychologists, and other healthcare providers to provide comprehensive care to older adults, and collaborate with community organizations to provide social support services. Long-term value of developing nursing discipline. In summary, the value of nurses is not only reflected in directly providing healthcare services to patients, but also in interdisciplinary research on the social determinants of health and their impact on health outcomes, and the development of comprehensive intervention models to improve the health status of the elderly and promote health equity. Countries must urgently develop the upper-level structure of nursing science and cultivate more nursing scientists to solve the challenges of immunization, preventable diseases, health maintenance, health education, health resource matching, and social support in the aging society. In the future, healthcare will enter to health mentor paradigm. The nursing team will play a crucial role in allocating health and social support resources to those in need to improve health equity. Competition and cooperation among nations exist not only in economic activities but also in the process of improving the health literacy of the population. The maintenance of health patterns is transitioning from rehabilitation to cure and evolving into a preventive model. A strong healthcare education system ensures that taxpayers' money is spent on technological development that improves people's quality of life rather than being invested in treating preventable diseases. Thanks for watching.